It is the start of a brand new year and a time when many of us resolve to take better care of our bodies. Statistics show about 1 in 5 of us live in pain, and you don't have to. Dr. Christina Captain is the lead practitioner at the Sarasota Center for Acupuncture and Nutrition. She is here to explain how they can help with chronic pain. I feel like this is the best New Year's resolution ever, to find a way to combat pain, because that is no way to live.
Exactly. So when you have chronic pain, which is defined as having pain longer than 3 months, it's debilitating. You know,
And
you
demoralizing.
can't, and demoralizing. It just takes your everything out of the joy of life away. So you're not playing pickleball anymore. You're not, you know, going and joining in the choir and standing and singing for a long time, or meeting people at church, or whatever it is that it sparks your joy. You're not able to do it. Playing with your grandkids, getting on the ground, you know, just going for a run, whatever it is, you're not able to do it. Just merely walking.
Yep.
From your car to a shopping center, or walking around a show where you want to buy something, a craft fair. You can't do it because your knees are hurting too bad, your hip is hurting too bad, your back is hurting too bad, your neck is hurting too bad. Now, the deal with chronic pain is that it can be resulting from many different things, all right? So we can look at it coming from an injury that happened very recently or a long time ago. It can happen from chronic degeneration, being aged, or abusing your body in sports and whatever else. You may have had an issue with, you know, vertebral fractures or pains in the back from arthritis or stenosis, just from degeneration. Then, or your joints, just from degeneration. Then you can have a failed surgery, a surgery that just didn't go the way it was supposed to go. And surgeries are fantastic. We need surgeons. We love surgery when they work, but when it doesn't work or it's failed, we need to have somewhere to go to relieve that pain, and that would be us. We provide that hope to manage chronic pain, and then sometimes resolve it really, really well, so that you don't have to have the next surgery, or you don't have to take the pain pills anymore, and just be able to go to walk around the art shows, to buy something for yourself, to go to a mall, to go grocery shopping.
Right.
All those things,
all the good things
are
we
impacted.
need to do.
Yes.
So when someone comes to talk to you and describes the pain that has, you know, gone on for a long time, how do the assessments work in your office?
Right, so we're looking in 2 different worlds, right? We look in the Western medicine world, and we look in the Eastern medicine world. So many times in Western medicine world, we're reading the reports from an MRI or a CT scan or something else, a surgical report, that we can see what's happening and where it's happening, and typically why it's happening. But sometimes the why is nefarious. It's hard to find. You got to investigate it, right? In Eastern medicine, we can look at patterns. We can look at patterns that are relatively known more as inflammation in Western medicine, and we can treat those patterns with acupuncture, with herbs, with nutritional supplements, with exercise, and we love them to go to physical therapy or chiropractic too. That's fantastic, in tandem with acupuncture.
So there's certainly things that you can do that maybe hasn't been presented in Western medicine.
And in combination with. So typically in Western medicine, you're going to run through pain management, you're going to look at medications, maybe steroid injections, other types of injections, maybe looking at, you know, hyaluronic acid to go into the middle of the joint. We're going to be looking at, you know, possible surgical issues, and epidurals and procedures and things where you keep going until you become the surgical candidate, and then you go in for the surgical consult. In our world, let's try everything before we get there. Let's try everything before we get there. Let's strengthen your body. Let's figure out how to decrease your inflammation. Let's tackle the actual pain with modalities such as acupuncture and electricity to absolutely manage it. I mean, people walk out, they're like, I can't even believe this pain is so much less. From acute issues, like over the Christmas holiday, I had a sciatica come in, and we needed to help her right away, and we did. You know, it was manageable for her to get through the holidays. It's not fixed, because pain, especially chronic pain, is a commitment. It's just like being committed to do your stretches every day, or your strengthening exercises, or you're walking because you have osteopenia or osteoporosis and you want to strengthen your bones. You need to walk. New research just came out that postmenopausal women, all they have to do is walk 45 minutes, like 5 days a week.
Okay.
And it's helpful.
Right.
Like super helpful.
Which
more helpful than running a marathon.
Which seems ridiculously easy, but it is the commitment to doing it. So, and I think what people hopefully would take you know, peace in hearing is that you can provide some solutions that maybe had not been entertained before.
We can provide hope.
It's still a lot of work,
yeah,
but it's hope.
Yeah, it's still a lot of work, but it's hope. And it just takes that level of commitment to suddenly know that your neuropathy in your hands are better, and you can feel the glass, you can feel the toilet paper in your hand, you can feel your feet while you're driving, so that driving hasn't been taken away from you because you can feel your feet now. I mean, it's significant to change these types of issues of chronic pain, but it's the hope. you know, and we have plenty of testimonials on our website for you to look at in video form and in written form.
Love that.
For you to see that people have achieved what you're looking to achieve. So if you have this problem, just please contact us. It doesn't hurt you just to talk to us to see what we can do, if we can provide you some hope. If I don't think you're treatable, if I don't think you're going to make progress, I'm not going to bring you into my practice. You know why? Because I have great statistics, and I don't want to lose those statistics because I say, yeah, let's try with you.
So I think we could say this is great for New Year, new hope for anybody suffering from chronic pain. There are great options out there. To talk to Dr. Captain, you can go to scansrq.com.